At OJOOK, we see mouth as a organ that's a gateway that really represents and is a window for our overall health. But we wanted to kind of hear from this panel what other health concerns can be caused by having poor oral hygiene.
I mean, whenever you have tooth pain or loss of teeth, it's going to directly affect your nutritional intake, and stress that can be related to that. But when it comes to like oral health and general health, I feel like it's a two-way relationship. So oftentimes, whenever you have a systemic condition, it really manifests in the oral cavity first. So that's why, dentists, like the routine checkups in the dental offices are important because we can find things that you may have not noticed. So it could be a good warning sign. And also, when you're pregnant and your hormones change, you can notice that your gums swell. So all these changes that happen in your body can really show in your oral cavity. So I would say it's directly related both ways.
Yeah, so as far as bacteria goes, so bacteria in the mouth doesn't stay isolated to the mouth. It can go throughout our body. And, touching briefly on different things, it's been linked to, pregnancy issues. It can exacerbate symptoms of diabetes. It can increase hypertension. And then plaque, plaque itself blocks things up. So when you think about heart attacks or strokes, plaque can clog arteries, and there's more and more research reporting that even bacterial plaque and the biofilm that Dr. Prieto mentioned that's constantly forming on our teeth can, get other places in our body and increase our likelihood of stroke and heart attack.
Mm-hmm. Oh, really? The plaque in your mouth can go to like your artery?
Well, I don't know if it's the exact same composition, but what makes a biofilm so difficult is that as it's stronger together than any individual bacteria can be. So as it binds together, it becomes harder to break up. And if you just picture chunks of bacteria moving through your bloodstream, blood that normally passes through, pipes or arteries smoothly can stick to different spots, and that slows down the blood flow, which can then lead to high blood pressure, stroke, heart attack, and things like that.
Like the type of dental bacteria, so the type of oral bacteria, they've actually found congregate in certain sites elsewhere. So sometimes on prosthetic joints, sometimes anything prosthetic in the heart. If there's an issue, maybe with placement of that device or some sort of complication in surgery, they can actually find a collection of oral bacteria in that area, because pretty much anything that's in your mouth is picked up by your bloodstream and is brought throughout the entire body. Your bloodstream is like the highway, and it's just bacteria are the cars passing by each neighborhood. So anything can come and collect it.
Okay. Wow, that's gross. More reason to floss.
More reason to floss. The less bad bacteria you have in your mouth, it's about the bad bacteria. So the less bad bacteria you have in your mouth, the better. So you really want to try to mechanically remove that.
I mean, specifically for me, what I deal with my patients as a prosthetist, I deal with a lot of patients who've lost a lot of their teeth or have no teeth at all. And just seeing how that affects their quality of living and how it can be really tough sometimes. You can see patients decline pretty fast if they're get to those situations where they're just aren't able to have the appropriate teeth in their mouth to function anymore. And that kind of is a process from, having that bacteria start out around our teeth, and then it could potentially eat away at or deteriorate the gum and bone health, or, just the actual tooth structure itself. And so, we always want to prevent that. That's our goal. We want to prevent that. And we have things in dentistry that we can also solve those problems and get patients back to the proper form and function. But we want to try to avoid that because it can be really tough for our patients. And even if we do have those certain solutions for them, there's certain time frames which can be really hard where they're not able to really have that proper function anymore.
That's very interesting point. One of the reasons why OJOOK started as an oral care is in Korea and in Eastern medicine, having the full set of teeth in your late 80s, 90s is the symbol of life and symbol of health and longevity, because the fact that you're able to chew your own food down is the nutritional health, as well as I think bones, heart, and your brain health. So I think this is kind of where the, this philosophical wellness kind of matches to the science. It's so interesting.
Like one's oral health is kind of a proxy for the rest of your physical health. If someone is the type of person that they take care of their teeth in the sense that they make the time and have the discipline to brush in the morning and at night, floss at night, see their dentist regularly, and take heed to the recommendations of the dentist, that probably more likely than not is the type of person that also takes care of their health in the sense that they have proper nutrition, they watch what they eat, they exercise, they sleep well.
That's a very good point. Like, is there any indication of poor health in other parts of body that you can see from or observing from oral health?
I've seen some patients that have like a good routine, but their complaint is, like they don't have enough saliva. So when it comes to patients like Sjogren's syndrome or patients with gastric reflux, for patients that are taking a lot of medication, oftentimes the side effect could be, drying of mouth. Just recommending certain supplements or recommending certain treatments that could benefit them, when there's reduction in saliva. I think that's something that we can commonly see in our practice.
What's, I guess, pretty close to me, or something that I'm a little more passionate about now with education, is sleep disordered breathing or sleep apnea. Because this is something that if isn't caught or treated is killing patients, or you can die from it. So we, in the mouth, you'll see signs of clenching or grinding, which is where we'll ask follow-up questions, because some people are grinding from stress. Some people are grinding because if you're struggling to breathe in your sleep, you're actually fighting and your muscles are contracting. If you have an enlarged tongue, there's an entire screening process, but enlarged tongue, wider neck, scallops along the tongue, so there are grooves in the tongue that show where you actually press against the side of your, against your teeth to fight to breathe. Sometimes it just takes a few more questions from us, and we can point you in the right direction for a sleep study or possibly having an appliance made. And this is actually something that is saving lives. So I think it's an important thing for dentists to check for.
Yeah, we might not necessarily be making the actual diagnosis, but we're kind of catching the early signs potentially to make sure that we're getting onto the right person to be able to treat them.
Most patients that value their teeth do come see us twice a year. So from the moment they walk in, with us taking their blood pressure to what goes on in their mouth, we can often pick up on something that they might not have ever been made aware of. So as soon as you come into the office, if your blood pressure is a little bit high, we might refer you to a family doctor to take a look. If we see signs of erosion on your teeth, we'll do a basic health history, dental history. We'll find out about your diet. It could be coming from your diet. It could be coming from your GI. So it could be a digestive issue. It could be acid reflux, things like that. So we do kind of notice early stages of issues that the patients are either not aware of yet, or, may not have had pointed out to them by a physician yet. Yeah.
What are the best methods to maintain good oral hygiene?
I recommend having a daily routine of just brushing in the morning, brushing in the evening, flossing in the evening. People always ask about mouth rinse. I say if it's something that you feel like you need for your routine and it's something from a periodontal standpoint you need, go right ahead. But what I really need you to do is just to brush and floss. I ask them to be very careful with acidic items. So yes, you can partake. You can have vinegars, which are acidic. You can have lemon, oranges, grapefruit, carbonated beverages, wines, all of those things you can partake in, but you have to be careful when you're doing that. So I always advise drinking water after to dilute the acidic effect. I advise drinking through a straw if possible. Even coffee is acidic. Now, we're not talking about, partaking once a day. It's for people who constantly snack and constantly sip on these items. It's a problem. So think about going to the gym and every 10 minutes or so, you're taking a sip of Gatorade. That's a constant assault on our enamel of acid. constant. And our mouth is capable of buffering this acidity, but it happens in every 20-minute cycle. So if you're interrupting that pre-20 minutes, so every 10 minutes you're sipping, you really are working to erode that enamel away. And over time, you know, our enamel thickness varies from 0.3, 1.2 millimeters on our teeth, roughly. I'm estimating every few years that's going to decrease. So I recommend avoiding that.
Yeah, I think with like the eating too, like, and you touched on this, like the frequency is like pretty big too, because our body can get back to the proper pH, the proper like acidity, and well, to a level that's more basic and neutral, but it takes time to get there. So if we're constantly reintroducing acidic things to our mouth, snacking, drinking something that's acidic, it's never going to get back there, and it's just going to create an environment that is more favorable for the bacteria to kind of eat away at our tooth structure. So yeah, cutting down the frequency, trying to integrate water anytime you do have something that's acidic, I think it's always going to kind of help combat that process that's going on.
If we're consistent with our routine and with our oral habits, then when things happen, the prognosis is a lot better. If we're brushing and flossing every day and you forget your toothbrush on a trip and you go a day or two, your gums aren't going to start bleeding from that. So it's really about just staying on top of it, doing it when you can, but really being intentional about making sure this is something that happens where you feel incomplete if you don't get it done, as opposed to it being a chore.
Any other like habits that you should stop doing for good oral hygiene?
No smoking, but yeah, I think that's a pretty common one.
Don't chew on ice.
Yeah.
Don't chew ice.
Don't chew on anything.
Please don't.
Don't open bottles with your teeth.
Yeah. You don't want to do that. Having good sleep is very important. Reducing stress, like Dr. Cummins mentioned, you know, I see so many patients with cracked teeth. That's like so prevalent here in Singapore. Everyone has cracked teeth. So reducing that stress level is super important.
Thank you so much for talking about health problems and highlighting, you know, the bodily health can show in oral health and vice versa. I think this was really helpful for our customers to learn about taking even better care about our teeth, because it's not only oral care, but also in our entire body. Thank you so much for joining today.